Are you sick and tired of being sick and tired? And maybe you've been stuck on that medical merry-go-round, taking drug after drug, going and having all the different tests run, and everything comes back with basically they don't know, no answers. Well, the next 10 minutes could change your life. Pay attention. Let's talk about the current healthcare system. It's really not a healthcare system at all. It's actually more of a disease care, sick care, or crisis care model, because what they do is their only concern is making you feel better, right? And that's about treating symptoms. Well, let's talk about symptoms for a minute. So if you put your hand on a hot stove, you're going to start to have symptoms. Now, are they good symptoms? Are they bad symptoms? Well, it hurts, okay? But those symptoms are there to tell you, hey, dummy, move your hand. So it's really about trying to protect you. And literally all symptoms are a warning sign to you to tell you something's not right. So when you cover them up, it's like waking up at 3 o'clock in the morning, your fire alarm's going off, and you get up and just yank the battery out and go back to bed. Okay, I'll give you another analogy. Let's say you saved up your whole life for like the nicest car you've ever dreamed of, right? A Mercedes, a BMW, a Lamborghini, I don't care. Let's take a Lamborghini, for example. So you're driving down the road in your brand new Lamborghini you saved up your whole life for. Okay, all of a sudden you look down, the freaking engine light's on. Okay, so what do? Well, don't know what's wrong, but something's wrong, right? So you take your Lamborghini, probably not to the 5 and dime mechanic, but probably the specialist, the guy, right? The guy that knows more about Lamborghinis than anybody, like the Lamborghini doctor, right? Okay, so he's at the dealership. You go pulling in your Lamborghini, pulls in, take a look. He's like, I got just the thing. I'll be right back. He comes back, a little spray paint, engine light's gone. Well, then that must be okay, right? I mean, there's no engine light now, so what do? Get back in your Lamborghini, driving down the road. Eventually, what's going to happen? You're going to have a much bigger problem than an engine light, right? Something's going to break down. You're going to have a much bigger issue. Well, you realize that when you take a headache, or when you have a headache and you take a Tylenol, you just spraying over that headache, right? I mean, you don't think headaches come from a Tylenol deficiency, right? No. And as a matter of fact, there's never been a disease, a sickness, an ailment that was the result of not enough medications, right? Nobody's ever had a Vicodin deficiency, an Ambien deficiency, a Zoloft deficiency. It doesn't matter. No drug has ever been, or absence of drug, have ever been the cause of any ailment. So taking drugs have never fixed them. They just covers it up. Another example, migraine headaches, right? A lot of people have migraines. Well, typical mechanism for a migraine is the brain says I need more blood, right? So the heart speeds up, push blood against gravity, get blood to the brain. Well, another mechanism has to kick in, and that means the blood vessels have to dilate. They have to open up to allow for the extra blood. Those nerves come right out the top of the neck at the brainstem, and they go up into the head and neck, and they tell those nerves, or tell those blood vessels what to do. Well, if the message doesn't get there, then they don't dilate. So you're pushing a lot of blood through a small opening, the veins or arteries, and so they get irritated, they get inflamed. That causes the pain from a migraine, right? Well, you go and you take your Excedrin migraine, your Imitrex, whatever. Maybe it'll mask the pain, okay? But it doesn't fix anything. The problem's still there. So what research has come out with, Journal of American Medical Association did research, and they found long-term migraine sufferers, which 10 years or more, 80% have a stroke. 8 out of 10 migraine sufferers have a stroke. Those aren't good odds if you have migraines. Well, if you think about the reasoning behind that, you have small blood vessels, you're trying to get the blood through, you're not getting enough blood to the brain, you're slowly starving the brain, which is literally what a stroke is, right? So it's not worth it to continue to mask the symptoms while you potentially get more sick. So another problem, America is the most expensive country in the world. As a matter of fact, we spend more than twice ourselves out of pocket, more than twice the next most expensive country in the world, based off the WHO, the World Health Organization. And then on top of that, out of the top 80 countries in the world, we rank 43rd in overall health, and in value, out of the top 80 countries, we rank 79th. 79th out of 80. There's only one country that's worse than us, which means we're spending a lot of money and getting a very small return. So the system is flawed. When you add on top of that, 70% of all drugs manufactured in the world, okay, and America makes up about 4% of the world, but that 4% consumes 70% of all drugs. 70% of all drugs. 80% of all pain pills. Americans are over-medicated, doped-up community, and that's why we're getting sicker and sicker, because if drugs work, we take all the drugs, we should be the healthiest people in the world, right? So, by design is flawed. Now, I want to say one last thing about this whole crisis situation, the crisis care model. If you were to drive down the road and you had an accident and you cut a leg off, you cut a major artery, you got an eyeball hanging out, don't call us, okay? That's where I wouldn't want to be anywhere else in the country or anywhere else in the world than in America. We have the best true crisis situation, crisis care model in a true crisis situation, which that's what that would be. But you can't use crisis care to try to return health. It's like if you had a person that's completely healthy and you just started giving them drugs, what do you think it's going to do? It's probably going to start to make them sick, right? So why do we think you take a sick person, give them drugs, it's all of a sudden going to make them healthy? It doesn't work. You can't use a crisis care model to return health. So what is health? So that's the big question, right? So we know it's not about how you feel, okay? And we know that you can't get health back from taking pills, potions, lotions, so what do you do? Well, so where does health come from, okay? Well, let's say you cut your hand, okay? What happens? You keep it clean, then what happens? Well, the body actually has its own system that comes in and repairs the injury, right? We've all done it and it heals itself. Well, that's where all healing comes from. It all comes from within. Matter of fact, it comes from the nerve system, travels from the brain, through the brainstem, down the spinal cord to every single cell in your body. Every organ system, every muscle, every tissue has a direct communication to the brain that coordinates those healing messages. So when you cut your hand, the message sends to the brain that, hey, we got an injury down here. The brain then coordinates and puts together all the healing parts you need. It puts together, brings new tissue cells and new repair cells and new chemicals to come in and make sure that everything bonds and comes together right. That's where healing comes from. It comes from the nerve system. So to give you an example, here is your head looking from behind. The brain sets in here. All the messages from your brain go through these top two bones, down the spinal cord, out the spinal nerves to every single part of your body. Now, as long as all the messages are working properly from the brain to the body, then the body is fully healthy and it can heal from anything, any injury, any trauma, any sickness, okay? But there's one place and only one place in the body that can interfere with the nerve system without having some gross pathology, you know, a severed spinal cord or a broken bone or something. But one of these top two bones, the atlas being the top bone because it holds up the head of the world, the axis being the second bone because that's the bone that the world pivots on. If one of these bones get a little out of position, it can literally put pressure on the brainstem, which can interfere with the messages from your brain down the spinal cord to the body. What that means, nerve system controls everything. Heart rate, blood pressure, digestion, immune system, reproduction, elimination, how you sleep. Everything in your entire body is controlled through the nerve system, which means every message that goes through this brainstem can be interfered with, can be reduced, and can then ultimately lead to malfunction of any one of those systems, organs, any parts of the body. So any kind of trauma typically starts early, could start early in life, could be birth, could be a slip, a fall, a car wreck, a sports injury, a fight. I've heard everything in 30 years, but if one of those bones gets a little out of position and squeezes down on the brainstem, like stepping on a garden hose, it'll interfere with the messages going to one or multiple parts of your body. If those messages get interfered with, it doesn't get the full nerve message from the brain to function properly, then it doesn't work like it should. Let's say it's going, say, to the pancreas, okay? The nerve's going to the pancreas. Well, the pancreas has one primary function, and that's produce insulin. If the message gets interfered with between the brain and the body, or brain and the pancreas, then the pancreas now produces less than proper insulin, and then you start to get symptoms. You go to your medical doctor, and what's he going to do? Oh, well, let's find out where the interference is to the pancreas and preventing it from working properly. Of course not. What do they say? Oh, just take these. You know what? Take these pills. You'll never need insulin again. You don't have to worry about that pancreas. And by the fact, you'll be a patient of mine for life. And you just keep coming back. And when the pills quit working, we'll give you shots and you can just shoot yourself. And then, you know, you can eat whatever you want to and you'll be a diabetic the rest of your life, right? They're not going to look for the cause because if they fix the cause, then you don't need them anymore, okay? What if it's the nerves down here that go to the colon? Well, what's going to happen? Well, the colon doesn't work the way it's designed. What does that mean? Well, I don't know, okay? Maybe it moves too slow. You get constipated. Maybe it stops altogether, like Crohn's disease, right? Problem with Crohn's disease is a part of the colon just quits working. So what do? They go in, they cut that part of the colon out, reattach the nerve. What do you think is going to happen? Well, now that part of the colon stops working the way it's supposed to, and they cut another part out. Next thing you know, you got a bag on your side, right? That's not fixing anything. That's just masking it, treating the symptom once again. So if these bones are out of line, then it can interfere with the messages anywhere in your body, head, face, and neck. There are no nerves that come off the brain. So if you have headaches, dizziness, ringing in the ears, even mental problems like anxiety, depression, learning disabilities, those are all nerves that come off of the brain, go back up into come off the brainstem, go back up into the head and control everything around the head, face, and neck. So that can all happen just via the brainstem. Matter of fact, every message goes through the brainstem to every part of the body. Even brain-to-brain communication transmits via the brainstem. Now, structurally, what happens is your head sits on top of these two bones. Anywhere those bones go, that head goes. It really has no choice because the head just sits on top. Well, the brain sits in here. Your brain's designed to be level always. It has its own reflex called the writing reflex. The whole purpose is to make sure that brain always stays level, parallel to the ground. But if one of these bones get out of position, it will take that head, which in turn throws the brain off balance. Writing reflex kicks in, doesn't like it, sends messages down, forcing your body now to compensate till it gets the head level again. This will start a chain reaction through your body of twisting, turning, bending, rotating, whatever it's got to do to get the head level. Now you end up with compensatory changes in your neck, upper back, lower back, hips, knees, feet. Over time, those compensations become weaknesses that can turn into neck pain, upper back pain, lower back pain, hip pain, foot pain, knee pain, right? So I'll give you an example. Let's say the top bone went this way, took my head that way. Now to try to get the head level, it might cause me to lower one shoulder, raise one hip, creating compensatory changes. So now one side has to stretch, the other side has to contract, becomes a tug of war. You end up with muscles fighting each other, which can turn into chronic neck pain, back pain, all the way down. Sciatica can affect the disc, nerves going down the legs and down the arms. So if any of these sound like you, then this might be what you're looking for. If you're tired of the medical merry-go-round, you're taking medications, you've had all the tests, and maybe they keep coming back negative saying there's nothing wrong. Well, there's obviously something wrong, and you need to quit chasing symptoms and trying to cover them up, and now let's get to the root cause. So give our office a call. We'd be more than happy to get you in and find out exactly what's causing your problem, get the problem corrected once and for all, and allow your body to finally start to heal and work the way it was designed.